Jai Shri Krishna. A very warm welcome to the day 21 of my YouTube channel, Dental Tips. Today's topic of discussion is a brief about deciduous teeth and a brief about deciduous central incisor. As discussed in previous videos, deciduous teeth are 20 in number. They lack premolars, and by the age of 23 months, that is 1 year and 11 months, all deciduous teeth have erupted in the oral cavity, and every attempt should be made by the dentist to prevent the premature loss of deciduous teeth. Deciduous teeth are also known as milk teeth or primary teeth. Now, we also discussed that every tooth has two portions, coronal portion and radicular portion. Coronal portion or crown is visible in the oral cavity, and radicular portion or root portion is present in the socket. When we look at the deciduous central incisor, from the labial surface, that is the surface facing the lips, we see that it is more convex mesiodistally as compared to incisor-cervically. Now, when we go to the lingual aspect of deciduous central incisor, lingual aspect is that portion of deciduous central incisor which faces the tongue. It has a cingulum and it has a marginal ridge. And cingulum is a bulbous projection at the cervical half or cervical 1/3 of the lingual portion of the tooth. Now, between the cingulum and the marginal ridge, there is a depression which is called as lingual fossa. Now, when we come to the mesial aspect of this central incisor, deciduous central incisor, it is less convex as compared to the distal aspect. Mesial aspect is which is towards the midline of the face, and distal aspect which is away from the midline. So, the distal aspect is more convex, and there is uniformity in convexity, and mesial aspect is less convex, it is slightly convex. Now, when we come to the incisal edge of deciduous central incisor, the incisal edge of deciduous incisor is more or less straight, and it meets the mesial surface at acute angle, and the incisal edge at the distal surface, it meets at an obtuse angle, rounded and obtuse angle, slightly rounded and obtuse angle. Now, when we come to the root portion of this deciduous central incisor, the root is always single, and it is tapered. It has a blunt apex, and it is slightly distally inclined. Slight distal inclination is there. Now, when we come to the pulp is present both in the crown as well as in the root. In the crown, it is called pulp chamber, and in the root, it is called pulp canal. Pulp canal in the root is single and it is tapered, and in the crown, the pulp chamber, it is very large, and there are pointed pulp horns. And the pulp chamber in the deciduous central incisor, it determines the shape of the crown. Like whatever be the shape of the pulp chamber, the shape of the tooth, crown of the tooth is going to be the similar. So, with this, I end my today's topic. Thank you many folks for watching my YouTube channel, Dental Tips. Jai Shri Krishna.